Well, good afternoon, and thank you all for joining me here today for this very special announcement. Today, we take a big step forward in our collective efforts to address homelessness in our city. I'm joined this afternoon by presidents from all of our local hospitals, including Dr. Rodonda Miller from Johns Hopkins, Dr. Mohan Santa from the University of Maryland Medical Center, Brad Chambers from MedStar Union Memorial and MedStar Good Samaritan, Dr. Stuart Levin from MedStar Harbor Hospital, and Christopher help me with it, Chikoris. All right, he just told me that, Chikoris, Interim President and CEO of St. Agnes Hospital. I would also like to acknowledge Christopher Thomas Cuddy, who is here representing Mercy Medical Center, and Martha Nathanson, who is representing Sinai Hospital. I want to also recognize Kevin Lindemood, President and CEO of Healthcare for the Homeless, who is here and is a partner as well. I also see friends from local HUD field office, the State Department of Health, and Baltimore Continuum of Care Board. Thank you all for joining me here today. As Mayor of Baltimore, I'm committed to ending homelessness and not just managing it. To that end, I recently announced the formation of a standalone office of homeless services led by Jerry Ann Anthony, who is here with us today. Where are you? Is she here? Jerry Ann? Oh, she's not here? Okay, I'll get her for that. We can all agree that access to quality permanent housing is one of the best ways to end homelessness. Unfortunately, this type of housing is in short supply, and as is funding for the supportive services ensure individuals and families are able to sustain their housing and not experience a return to homelessness. The Mayor's Office of Human Services has crafted a strategy to provide additional housing that is not wholly dependent on limited federal resources and which targets our most vulnerable homeless households. The strategy combines Medicaid funding and private investment with creative housing options such as the recent renovation of 14 large public housing units that were used to provide permanent homes for previous homeless families. I want to recognize the contribution of the Housing Authority of Baltimore City and Baltimore Housing on this initiative. The use of Medicaid funds to cover the cost of critical supportive services was made possible through the city's participation in the state. Where am I? Provide permanent housing and critical supportive services to approximately 200 of our most vulnerable individuals and families. The hospital's investment will be used to cover the 50% required match for the state Medicaid pilot. This will also allow the city to reallocate funds to other important initiatives to address homelessness. The investment will also establish a client assistance fund to remove barriers to housing. This can include rental application fees, security deposit, furniture, home goods, and transportation to medical appointments. You will now hear from Dr. Miller and Dr. Santa, who will speak about this partnership from a hospital perspective. They will be followed by Kevin Lindemood, CEO of Healthcare for the Homeless, the supportive service provider for this initiative.
Good afternoon. My name is Rodonda Miller, and I have the honor of serving as the president of the Johns Hopkins Hospital. I am thrilled to be here today and excited that Johns Hopkins will be a part of such an impactful collaboration between our federal, state, and local governments, Healthcare for the Homeless, and our Baltimore City hospitals. I'd like to take a moment to thank Mayor Young and his team for their leadership and advocacy of this important program. As a result, Baltimore is moving forward with 200 supportive housing slots, meaning that vulnerable individuals and their families will receive much-needed houses and wraparound services. On behalf of my city hospital colleagues, we are grateful to have the chance to take part in this public health initiative. When Terry Hickey and Kevin Lindemood first approached us with the idea of a supportive housing program, there was palpable enthusiasm in the room. There was energy. There was the sense that, yes, this is the right step forward. After all, each of our hospitals had a similar story to tell. A story of patients with no stable home who returned to our emergency departments time and again for care. A story of our social workers who labored to connect these same patients with resources, but still struggled to find a more effective answer to wellness. And a story of leaders who wondered if we could have a broader impact if we all worked together. The links between health and housing are well documented. In fact, in its 2019 annual message, the Robert Wood Johnson Foundation emphasizes this link, noting that an individual's living situation is crucial to his or her overall health and wellness, playing a role in everything from quality education to jobs to healthy foods. As healthcare providers, we immediately recognized that this sustainable housing program could improve the health of our communities, and that by working together, we could do more for our Baltimore City neighbors who are experiencing homelessness. As anchor institutions, it is both our privilege and responsibility to address our neighbors' concerns, to work with them to problem solve, and to invest in solutions. Today, I'm proud to stand before you to report that all of our city hospitals are taking part in this innovative collaboration. Supportive housing is certainly one solution. It is not the first solution, nor will it be the last. But it will play an important role in our efforts to address the social determinants of health that negatively impact our neighbors' well-being. Put simply, we know that this initiative will make a difference. It is the right thing to do for our patients. It is the right thing to do for Baltimore. Thank you for allowing us to play a role.
Whose phone is that?
Good afternoon. My name is Dr. Mohan Suntha. I'm, again, privileged to serve as the president and CEO of the University of Maryland Medical Center, both our downtown and our midtown campus. And as my colleague and friend, Dr. Miller, described, today is a good day. Today is a day that demonstrates the power of partnership between private and public organizations and enterprises that can come together and take on some of the most significant challenges that we face as a community. Those of us who represent the healthcare institutions of Baltimore have long understood the critical role that the issues such as homelessness and housing insecurity play in the health of our communities. We're privileged to be able to partner with the City of Baltimore and the State of Maryland to take on this challenge in a unique and innovative way. Partnering with organizations like the Weinberg Foundation and Healthcare for the Homeless, we're privileged to stand before you today to announce this initiative that really does demonstrate how Baltimore is in fact moving forward, how we are taking on innovative approaches to take on long understood challenges. As Dr. Miller mentioned, all of us as leaders of hospitals in the city recognize the intimate link between social determinants of health and the needs that our patients have as they come to us in the acute healthcare settings. And we've understood for a long time that while we can solve many medical conditions within the walls of our hospital, we're often challenged to take on solutions that extend outside the walls of our institution. But today represents an example of how we're taking that challenge on within a unique approach. And we're doing that through key partnerships. All of us recognize, again, in the city of Baltimore, I'm sure that the medical center is not unique. When we look at our data and we see that 10% of our 35,000 patients who are admitted on an annual basis are in fact homeless. And up to a third of our patients have housing insecurity as they come to us with their acute health care needs. And so again, on behalf of all of our organizations, I want to thank Mayor Young for demonstrating true leadership and driving initiatives forward like this to take our city forward at a time where we have great need, but together we also have great resolve. So on behalf of the University of Maryland Medical Center, thank you for including us in this effort. And I'm now going to introduce Kevin Lindemood from Healthcare for the Homeless, who is going to speak on behalf of his organization.
Thank you very much. This is a very good day. More than 20 years ago, the first physician I ever worked with said to me in frustration, "You know, I can write a prescription for almost any disease imaginable. That prescription can cost hundreds, if not thousands of dollars. But I can't write a prescription for the one thing that I know that is going to improve the health of my patient experiencing homelessness, and that's housing." Also, about 20 years ago, Mayor Young, you and I started working together on a regular basis, and over the years, we have had many, many conversations about homelessness and the struggles of homelessness. We've ended every single one of those conversations with agreement that the ultimate solution is in housing. And yet we would too often lament that federal resources had dried up and there just wasn't enough housing. Under your leadership, the city has said, we're not waiting for the feds, we're finding innovative solutions today. And Dr. Miller, as you and I have spoken, this is fundamentally a story of partnerships. Around 2005, the city and Healthcare for the Homeless began acknowledging that we could move people directly into housing, give them the services that they need to stay housed. Making those services sustainable was always the challenge. We stand here today with representatives of every hospital in the city, but I have to say, and I think I speak on behalf of Terry Hickey, that we would not be here today without your vision and leadership. I know you eschew it, but I know your hospital colleagues also appreciate your leadership and vision, and they have all come to the table here around one shared vision, and that is a partnership to end homelessness. I think that partnership extends well beyond this 200-person Medicaid waiver. This will be very important, but I think this represents a coming together of housing and health and a broad community recognition, everyone standing together, asserting proudly that housing is in fact healthcare. Thank you.
Thank you. You can clap. I just want to finish up by saying that the data support this approach. Preliminary research shows that individuals who are placed in permanent housing with wraparound services experience a 53% reduction in emergency service utilization and a reduction of 60% in overall health care costs. We expect to see similar or better results throughout this pilot. In partnership with Healthcare for the Homeless, the city has already matched 100 households with permanent housing and Medicaid financing supportive services. The city just applied to the state for 100 additional waiver slots, which would double the number of people we are able to house over the next 12 months. The city has worked closely with the leaders of the 10 hospitals represented here today to secure their investment in a supportive housing strategy. I'm thrilled to announce a collective $2 million financial investment from the hospitals, which coupled with a $200,000 commitment from the Weinberg Foundation will allow the city to continue to help the homeless population in the city of Baltimore. And again, thank you.